From Universal Studios in Hollywood, California, it's Home and Family. Today on the show, colon cancer is the second leading cause of cancer-related deaths in this country, but it can be prevented with early detection and screenings. We have the latest information on that for you, so please welcome proctologist Dr. David Rosenfeld. Welcome, doctor.
Well, colon cancer is the leading cause of cancer-related death, second leading cause, and it can be prevented. You can decrease the risk of dying of colon cancer by over 50% with the screening colonoscopy. We'll talk about that and other ways that we can decrease the risk of colon cancer.
Great.
Yeah.
Thank you, doctor. Welcome.
We're going to raise the awareness too. So many people are embarrassed to talk about it or have it done, and we're going to try to tackle that as well.
All right.
March is a very, very important month. It is colon cancer awareness month, in fact. Colon cancer is the second leading cause of cancer-related deaths in the U.S., but it can be prevented with early detection and screenings. And here to talk about that and give us the very latest, please welcome proctologist Dr. David Rosenfeld.
Thank you.
Welcome, doctor. So what are the latest statistics on colon cancer?
So the American Cancer Society estimates that in 2015, about 140,000 Americans will develop colon cancer. Of those patients with colon cancer, 50,000 will die. Second leading cause of cancer-related deaths. It's more than breast cancer in women and prostate cancer in men.
So we want to stress that early detection and screening is important, but how vital is that?
It's extremely important. There's a study that just showed that having a routine screening colonoscopy will decrease the risk of death of colon cancer by over 50%. So colon cancer comes from polyps. If we find the polyps and remove them, we prevent patients from getting cancer. That's how it's preventable.
Sure.
At what age should we start getting colonoscopies?
50 is the age, but that's for somebody who just, walking off the street, they have no family history of polyps or cancer, they have no signs or symptoms of colon cancer. 50 years of age, screening colonoscopy. If it's clean, they can do it again in 10 years.
10 years.
If they have a polyp or multiple polyps, it's either 3 or 5 years, and it just depends.
Well, what if you do have a family history? What age should you start getting the colonoscopies?
It's a great question. For someone who has a first-degree relative, brother, sister, mom or dad, if the family member is of a certain age, it's 10 years before then. So if your mom had or dad had colon cancer at the age of 50, we would start screening at 40. But if there's a genetic predisposition, if there's a known gene in the family, we start at 20.
Really?
So,
Really?
Wow.
but 95% of colon cancers are not genetic. They come from polyps.
I will tell you this, as a man going, into those years, I heard so many stories from those who preceded me about, oh boy, you're going in for that.
Yeah.
And I was so hesitant for that experience. I didn't personally find it that bad, but a lot of people are embarrassed by it. They don't want to go through that.
That is the biggest challenge we face. One, education, and two, people being embarrassed to go get the test done. I mean, you think about it, if you go to the doctor, they're going to listen to your heart, they look in your eyes. Here's a test, you're lying naked on a table, and they're putting an instrument into the area that people are embarrassed about and looking throughout the large intestine. So, and then the bowel preparation, there's a lot of horror stories about that, and they're better now. It tastes better and it's not as bad.
Yeah, but you're put out, so you don't even know what's going on.
Correct. You're put out, you sleep. Some people are afraid of going to sleep. What if I don't wake up? That risk is so small.
Yeah.
I just think some people just don't want to do it, and they'll come up with any excuse not to. Most of my patients.
What should we be looking for when we say symptoms?
Sure. Symptoms are bad because we wait for symptoms to get colon cancer, then it's usually spread, and the chance of cure is extremely small. But blood in the stool, unexplained weight loss. So you're pulling your belt buckle, and all of a sudden, instead of being on the third hole, it's on the fourth or fifth hole.
Over a short period of time?
Over about, 6 weeks, 8 weeks.
Wow.
All of a sudden you notice that you're losing weight and you're not working out or diet changes. Blood in the bowl, unusual abdominal pain, change in stool caliber. It's normally big and it's starting to get thinner. That means there may be a blockage because stool's like Play-Doh and it's going to go through the lumen of the bowel that's now narrowed. So all those things they're bad, but if you do have those symptoms, definitely get checked.
If you have blood in your stool, is that a bad sign?
It is. If people have rectal bleeding, it's on paper in the bowl. It's usually hemorrhoidal, but I tell even my younger patients, let's look in the colon to make sure. But if it's mixed in the stool, it means that stool is rubbing by this cancer, the cancer's bleeding, it mixes in, and I say it's kind of like, I may be dating myself, like the old Goober's peanut butter and jelly, where the purple blood is mixed into the stool.
Sure.
Right.
So that's a bad sign.
You know, the other thing, if it's not embarrassment, people can say cost factors involved. Does insurance cover something like this?
Yeah, insurance covers a colonoscopy. Screening at the age of 50 or with symptoms, younger, that should not be a reason to not do a colonoscopy. And actually, they're not as expensive as people think if they did have to pay cash. And what's more important than your health? You know, if you think about it, and if you don't have to do it for 10 years, divide that up by 10 years, it's probably going to be about $10 a month.
Are there other things we can do to reduce the risk factor?
Sure, absolutely. Foods, as you see, are most important. I had the cannelloni. I don't think that's on the list of foods, but it was amazing. By the way, I'm going to go home and have a gallon of fiber.
You don't eat that way every day, no?
Make sure it goes through, but lowering meat consumption is important. Green vegetables, dark fruits, any type of fruits and vegetables, because they have antioxidants. Antioxidants are anti-cancer, which are fantastic. Beer, decreasing the amount of beer, because beer, high beer consumption is associated with rectal cancer. Exercise is also important. So lowering the amount of...
Wait, let's go back one second.
Yeah, sure.
Beer is what?
Associated with rectal cancer.
Well,
excess consumption
what's
of beer.
in the beer that... Is it yeast?
Maybe the yeast.
Okay.
Maybe, yeah. And it's overconsumption, not, you know, beer here or beer there. And we know red wine is good for the heart. Right. But too much beer is associated with rectal cancer.
Wow, did not know this. All right, so in the spirit of colon cancer awareness and colon screenings, we wanted to let our viewers know that the Colon Cancer Alliance and its sponsor, the Docalax brand, are always continuing to raise awareness of the topic and the importance of early detection and screenings.
You can visit Dr. Rosenfeld at davidrosenfeldmd.com. We'll share that with you on the screen. And also, for more information on Docalax's family of products and the Colon Cancer Alliance, please visit ccalliance.org/Docalax. It's all right there on your screen. Thank you so much,
Doctor. Very much. Thank you.
I'm going to take some of your greens
when
I go today.